Welcome. I am Terry Tropin, and today I'm discussing coding for wounds and other injuries. First, let me introduce myself. I have a Master's in Healthcare Administration Informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I am also an HEMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College in Maryland for over 20 years. I've also written some books on coding. These books are study guides that summarize the confusing coding guidelines. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external causes. These are available on Amazon. If you enjoy this video, please be sure to hit the like button and click on my picture at the lower right-hand side to subscribe. So here's what I'm going to be discussing today. Much of the problem with coding for wounds and injuries is how to look them up in the Alphabetic Index and how the tabular list is organized. Coding for fractures is discussed in a different video and will not be talked about here. Most of the codes for injuries are in the code categories S00 to S99. The first digit indicates the location of the injury, such as open wound of thorax, S21, and injury to muscles of shoulder and upper arm, S46. So we have the third digit for superficial injury is a 0, open wound is a 1, fractures 2, dislocation and sprain 3, injury of nerves 4, injury of other areas 5 and 6, crushing injury 7 and 8. Avulsion and traumatic amputations is 8, and other and unspecified injuries is 9. The fourth digit indicates a more specific site, right, left, that kind of thing. And the fifth digit provides even more specific information. Other injury codes that we'll talk about today are in the T section, T07 to T19. T07 is unspecified multiple injuries. T14 is injury of unspecified body regions. You'll see that the fifth digit under T14 is injury unspecified or suicide attempt. T15 is foreign body and external eye. T16 is foreign body in the ear. T17 is foreign body in the respiratory tract, and then it gets more specific as to where within the respiratory tract it is. The T18 is foreign body in alimentary canal. T19 is foreign body in the genital urinary tract, and we'll talk about those more later. Injury codes require a seventh digit to indicate the encounter. A seventh digit A is the initial counter when the patient is treated for the condition, active treatment. Surgical treatment, in our encounter, suturing, that kind of thing. It's also used when a new or the same physician is providing evaluation and continuing treatment of the injury. So that's treatment of the injury. D is subsequent encounter. The active treatment's been finished, over and done, and now the patient is being seen to check on the healing process, to see how they're recovering, make sure that the wound isn't opening up, make sure that there's no infection, that kind of thing. And S is a sequelae. The patient's been seen for treatment, the active treatment is over and done, but now there's a problem related to the previous injury. The injury is no longer there, has been successfully treated, but there's a sequelae of it. And a good example is a scar formation after the injury. So all of these will require a seventh digit. So let's start with superficial injuries. A superficial injury includes contusions, blisters, abrasions, superficial foreign body, and insect bites. Now these are called superficial, not because necessarily they are minor, but because they involve the body structures near the surface, the blood vessels near the surface, the skin, the underlying tissues of the skin near the surface. So you look these up in the Alphabetic Index: injury superficial or specific type of injury. And superficial injuries are S00, S10, S20, 30, 40, 50, 60, 70, 90, and 80 and 90, that should be. So, as we said, the third digit is the type of injury, and this is superficial. So let's look at open wounds. Open wounds include lacerations, puncture wounds, cuts, animal bites, avulsions, and traumatic amputations. This involves both the external or internal break-in body tissue, usually in the skin, though this is much more than the superficial wounds. So in this superficial injury, in the Alphabetic Index, this time you look up wound, open, and then specific type of wound. If you look up lacerations, if you look up avulsions, look up amputations, there will also be entries for those in the Alphabetic Index. And these code categories have a third digit of 1, S01, S11, S21, etc. Some wounds have foreign bodies in them, such as a splinter, bullet, food, dirt, gravel. It either entered the body through the skin or through an orifice, through a body opening like the nose or the ear. So for foreign body entering through orifice, you have T15 to T19, and these are specific. T15 is external eye, T16 is foreign body and ear, T17 is in respiratory tract, 18 is alimentary canal, 19 is central urinary tract. If the foreign body entered only the body structures near the surface, they're coded with S second digit for the location, and then 0 for superficial wound, superficial without open wound. That second digit here will depend on where it is located. So to find codes for foreign bodies in the index, see foreign body, then type of injury. So foreign body, then look up where it is, and then you have entering through orifice, you have superficial without open wound. With laceration, that entry refers you to laceration by site with foreign body. So there's a couple ways you can, so if you look up foreign body, it's a laceration, it'll just refer you to laceration. Also an indent for in-soft tissue, which is M79.5. Open wound with foreign body, it'll see puncture by site with foreign body. So in the Alphabetic Index, you can also look up penetrating wound, but that will just refer you back to puncture, which will say with internal injury, see injury by site. So it's kind of taking you around in circles. Okay, foreign bodies categories T15, T19 have excludes 2 notes. Remember, that means that if both conditions are documented, 2 codes can be reported. So it excludes 2 notes for these are foreign body and penetrating wound of orbit and eyeball, open wound of eyelid and periocular area, retained foreign body and eyelid. You see most of these are, I guess all of these are referring to the eye area. Retained foreign body and penetrating wound of orbit and eyeball, and superficial foreign body of eyelid and periocular area. So for example, for foreign bodies in the cornea of the right eye and also in the eyelid, you report T15.01XA for the cornea and S00.251A for the eyelid. So the instructions are saying report both. There are also some guidelines dealing with coding for foreign bodies. If the code includes external cause information, you're not going to also use an external cause code. That would be redundant and that wouldn't provide any additional information. For example, T17.220, food in pharynx causing asphyxiation. asphyxiation. T18.110 with additional with the 7th digit, gastric contents in esophagus causing compression of trachea. Now the external cause index tells you this. If you look up in the external cause index, choked, choking, food, or asphyxiation food, it will refer you back to T17 and T18. A code for a puncture wound is used when a sharp, pointed object penetrates the skin. In the alphabetic index, find puncture and then a site. Under the site designation, they're indent for foreign body and also for penetrating into peritoneal cavity or retroperitoneal space. So more serious puncture. And there are different codes to indicate that. These codes are included with open wounds in the tabular list. The alphabetic index also includes indents for by device, accidentally left an operative wound, complication, instrument during procedures. These are not traumatic injuries, but complications. So you're going to do that with a complication of a surgery, not with a wound, not with a puncture wound. Puncture wounds also include splinters. These are coded as superficial injury by site. Internal injuries harm the internal organs. See the picture of the knife going into the chest. These injuries may be intrathoracic, meaning affect the heart or other organs in that area. Intra-abdominal, intestine, spleen, liver, gallbladder, pancreas, stomach. They refer to the pelvis, which is an obstetric trauma, which is a complication of the delivery, or it can also have a traumatic injury to the urinary organs. So in the alphabetic index, look up injury internal. Now some indents under internal will refer you to injury by site. In other cases, it will find injury in a specific organ. Code for an internal injury and an open wound if this is appropriate. For example, you see this picture of the knife in the chest. So this knife is lacerating the lung and is an open wound. So you do S27.321A for laceration of the lung and S21.301A open wound thorax with penetration into thoracic cavity. So you're going to do 2 codes in this case. Crushing injuries. Crushing injuries occur with prolonged compression of a body part. Codes for crushing injuries are found in T14.8, S digit for site 7, and some S digit for site 8. So in the alphabetic index, you look up crushing, and this 2nd digit here will indicate where it's being crushed. So the instructions also say use additional code for associated injuries. Codes indicate specific areas and right, left, unspecified as appropriate. So you look up crushing. Traumatic amputations. These are found in the alphabetic index under amputation. There's a long list of codes, but under this, of indents under this, but be sure and go for traumatic amputation, not surgical amputation. So the guidelines state if the amputation is not identified as partial or complete, you should code it as complete. Avulsions. Avulsions occur when tissue or an organ are first forcibly pulled or torn away from its original location. So the alphabetic index find avulsions. Some of the indents under this main term provide a specific code. Many, however, refer you elsewhere. So if it's avulsion blood vessel, it sends you to injury blood vessel. If it's avulsion bone, it sends you to fracture. External site other than limb, see wound open by site. If it's an internal organ, see injury by site. If it's a limb, see amputation traumatic by site. Skin and subcutaneous tissue, see wound open. And then it does have lists for sites for avulsions, is the head, kidney, scalp, spleen, etc. But a lot of them just refer you to a different part of the index. A bite and may be from another person or from an animal. In the alphabetic index, find bite, then specific site. There are also indents for specific sites, superficial, and with penetration. Yow. The penetration may be into the peritoneal cavity or in the retroperitoneal space. While there are some indents here for specific animals, such as spiders and lizards, most codes are pretty general, just like animal. So how do you get more specific? Well, you go into use an external cause code, which are very specific. We'll say bite, bird, type of bird, lizard, type of lizard. It gets very, very specific. And bites are coded in the tabular list under S31, and then you'll most likely use an external cause code with that, and that will give you much more information. Intracranial injuries. These are traumatic injuries such as concussions, cerebral edema, and hemorrhage. There's a list here of what's included in this. In the alphabetic index, find injury, intracranial, traumatic. So there's a sixth digit requires loss of consciousness if it occurs, and if it did occur, for how long. And then, of course, you have the seventh digit for the encounter. There is a note under category X06 for intracranial injuries that says code also an associated open wound of head or skull fracture. Remember, code also means that you code both, but sequencing will depend on the circumstances. The 6 digits for these are very specific and indicate the time period for which the patient was unconscious. Not at all, 30 minutes or less, 31 to 59 minutes. See how specific that is. 1 hour to 5 hours, 59 minutes, 6 hours to 24 hours. And then it gets really specific. More than 24 hours, but the patient returned to consciousness. That's a 5. Greater than 24 hours, the patient did not revert to pre-existing conscious level, but the patient is surviving. That's a 6. Any duration with death due to brain injury prior to regaining consciousness is a 7. Any duration with death due to other cause prior to regaining consciousness is an 8. Unspecified duration is a 9. And it tells you code also coma if appropriate. So let's look at comas. So the guidelines will be changing for 2022, so I've included the new guidelines in here since it's not that far away. Coma scale codes in R40 section can be used with traumatic brain injuries. This is a clarification was added for 2022 that R40.20 may be used with other medical conditions resulting in comas. So it says coma scales can be used with traumatic brain injury codes. These codes are primarily used for trauma registry, but they're also used in other cases. R40.20 unspecified coma for any medical condition. So how do you look this up? You can look up either coma or Glasgow Coma Scale, either one. So before listing the code for the coma, list first coma and fracture of skull, coma and intracranial injury, traumatic brain injury, or sequelae of cerebrovascular disease. Okay. Do not report codes for coma for a patient with a medically induced coma or a sedated patient. So if the physician put the patient in a coma as part of the treatment, that's not coded using these codes. Okay, the Glasgow Coma Scale. To code for comas, you need 3 codes. one for eyes, one for verbal response, one for motor response. And you can see from the picture what the scores are. For eyes, open spontaneously, respond to speech, respond to pain, no response at all. For verbal response, talking, are they oriented, are they confused, is it incomprehensible, or nothing. And for motor response, moving, obeys commands like wiggle your fingers, moves to localized pain, flex to withdraw from pain, abnormal flexion, abnormal extension, or no response. So what you need to do to code this, assuming that you have the information, is one code from R40.21, one code for R40.22, and one code for R40.23. And then you're going to add a 7th digit. And this is different than the other codes we're talking about today because it's not specifically for encounter, but it's actually more specific to encounter. When was the scale recorded? In the field, like in the ambulance, that's a 1. 2, at arrival to the ER. 3, at hospital admission. 4, 24 hours or more after hospital admission. So when you're taking a scale and you're reporting R40.21, 22, 23, they all have a 7th digit, and the same for the same encounter, the 7th digits all have to match. Sometimes the documentation does not include the information to select codes for eyes, verbal response, motor response. So in that case, only a total score might be listed. In this case, use R40.24 with additional codes. For example, if the final score is 15, use R40.2410. So hopefully you'll be able to do the 3 codes. That's much more specific. But if it's not and all the physician documented was the total score, then you code this total score. If neither one, then you do that R40.20. Here's some new guidelines that are new for 2022, effective October 1st, 2021. If multiple coma scores are captured within the first 24 hours after hospital admission, assign only the code for the score at the time admission. ICD-10-CM does not classify coma scores that are reported after admission but less than 24 hours. So even if the physician orders that the scale is measured every hour after admission, you're only going to report the code at the admission, and the next code you're going to report is the 24 hours later. Okay, blast injuries. Blast injuries are caused by explosions. The primary blast injury is due to the blast wave, the motion, the air, the impact to the air. Secondary blast injuries are missiles or objects propelled by the blast. So how do you look that up? In the Alphabetic Index, the main term blast refers you to injury by sight. Under the main term injury, there is an indent for blast. Many of the subterms here will refer you back to injury by sight, but there are some injury by sight that include a specific code for blast. So it depends. So you're also going to code an open wound, any open wound for the blast injury. Associated open wounds from S31. And again, coding will depend. For example, if you look up injury intestine large ascending, there's an indent there for blast. And there's one for primary and there's one for secondary. So in some cases, there'll be a specific one for blast, but often there is not. Rupture injury. An injury may experience a break or tear due to an injury. This is a rupture. In the Alphabetic Index, be sure to use the code from rupture traumatic, okay? You'll see it listed by site, and if it's an internal organ, it will refer you back to injury by site. So for example, traumatic rupture of spleen is S36.09 with additional digits, other injury of spleen. So sometimes there'll be something for rupture and sometimes there's not. So let's look at an example. At the beginning of this video, I talked about the organization of the S codes. So here's an example for various types of injury to the left arm. Note that all these injuries start with S4. The third digit indicates the type of injury: superficial, unspecified, open. Puncture is done as open. With foreign body is open. Bite, open. Penetrating, 9. So you can see how this works. So for the injured left arm, they're all going to start with S4, and then the other digits will vary. So let's look at some guidelines for coding injuries. Now the guidelines state, do not use TO7, unspecified multiple injuries, in an inpatient setting unless that's all you got. There's no more information available. So in most cases, you're going to code for all of the possible injuries. And so you don't want to use TO7 because that doesn't really give enough information. Guidelines also state that do not use S00T14 for normal healing surgical wounds or complications of surgical wounds. Now that's kind of obvious, but just to make sure, there's a very big difference between normal healing surgical wounds and traumatic wounds. Okay, cellulitis is often a complication of an open wound. This is a deep infection of the skin caused by bacteria. In this case, you're going to code for the injury and for the cellulitis. Sequencing will depend on the focus of the visit. So you'll code for both. This is a complication of the injury. Sometimes osteomyelitis occurs as a complication of an open wound. This is an inflammation or swelling in a bone. Again, in this case, code for the injury and for the osteomyelitis. And again, sequencing will depend. Another possible complication is disheasance of a traumatic wound repair. Use a code from T81.33 for the disheasance and a code for the injury. So to see, this is when a code wound reopens after it's been repaired. So you're going to code for both. Sometimes the patient, unfortunately, will have multiple injuries. The guidelines state that if a patient has multiple injuries at the same site, code only for the most serious one. In the picture of the eye area here, this patient has a laceration and a contusion. Code only for the laceration. On the other hand, this older gentleman has multiple injuries in different sites. So these are going to be coded separately. The head injury, the neck injury, the arm, the eye. So each one is in a different site, so it will be coded separately. Other guidelines involve injuries to nerves and blood vessels. If the primary injury, the main injury, is such as a laceration or a wound, includes minor damage to nerves or blood vessels, code the primary injury first and then the minor injuries as appropriate. On the other hand, if a primary injury is in the nerves or the blood vessels, code these first and then other injuries. In this case, you see the primary injury is to the nerves, here's the spinal cord, and the nerves being broken, cut off. So that's obviously the primary injury, and then any other injuries you will code separately. But code this one first. The code guidelines also state that an iatrogenic injury, when caused by treatment, are not coded as traumatic injuries. We kind of talked about that a little bit before. Use the code for a complication, not an injury code. In this case, you see the port went through and punctured the bladder. That's not a traumatic injury. Certainly it's traumatic for the patient. So how do you look this stuff up? As I said, that's often the most confusing part of it. So here are some alphabetic index. Look up the specific type: abrasions, contusions, blast injury, lacerations. Penetrating wounds will send you to puncture, injury by sight. With internal injury, it'll take you injury by sight, and then with foreign body. Wound open and foreign body are also main terms in the index. Now, under the main term injury, you have injury superficial, you have injury by sight, abdomen, whatever, injury blast, injury childbirth, that's something different. Injury instrumental, that's something different from traumatic. Injury internal, injury intrathoracic, injury intracranial, injury interabdominal. So it's impossible to remember all the guidelines that we've talked about today and just in general. So I suggest you write these notes in your book. In the alphabetic index, find the main term injury and write in "see also wound open." It's very easy to forget that there's something other than injury that you can go to. You can also go to wound open and write in a note, "see also injury." With the main terms rupture and amputation, underline that subterm traumatic. You want to make sure, if you're looking for an injury, that you have a traumatic rupture, a traumatic amputation, not something that's surgical. In the tabular list, right next to code T07, write in "do not use unless no information is available." There's a lot of stuff with the Coma codes. Write in "used for traumatic brain injuries." For other medical conditions, use R40.20. Do not use for medically induced coma. Code inpatient comas only every 24 hours. And if no documentation for eyes, verbal, and motor, use only total score. Okay. Okay, that completes this video. If you have questions or comments, please feel free to contact me. For discussion of the new codes, I have two videos, one with the code changes and one with the guideline changes. If you enjoyed this video, please give it a like and a subscribe with clicking on the picture in the lower right-hand corner. Here are the books I've written on coding. These are available on Amazon. You can go to Amazon at the link in this introduction, or you can just go to Amazon and type in my last name, Tropin, T-R-O-P-I-N. Thank you so much for listening. I hope to have more lessons up soon. Thank you.